has been estimated that 70% of Houstonians suffer from repeated sinus and allergy symptoms, including watery eyes, itchiness, nasal congestion, sneezing, postnasal drip, and sinus pressure. Many patients only treat their symptoms with medication without addressing the underlying cause of their recurrent problems. This results in needless constant suffering and worsening symptoms. Others may be given antibiotics several times for the same sinus infection year after year. The Pasha Sinus and Allergy Center is designed for those of you who are looking for real, long-term solutions, using the latest diagnostic techniques to find out why you keep having problems, and the latest therapeutic options so that we may continue to reduce your symptoms under our care. Before we begin, it is important that you understand some basic anatomy and terms. The nose is more than the part that you see. Inside the nose is much more complex. The septum is the wall that divides the left and right side of the nose, and if crooked, may cause nasal obstruction or block your sinuses. The turbinates are the fleshy shelves that may become enlarged during a cold or allergy. The turbinates are what contributes to the sensation of nasal congestion. The sinuses are filled spaces located in your cheeks called the maxillary sinuses, forehead or frontal sinuses, roof of the nose or ethmoid sinuses, and the back of the nose or sphenoid sinuses. When blocked or when infected, this may cause sinusitis. The first step in solving your nasal complaints is to determine what exactly is causing your symptoms. After all, not all runny noses are from sinus infections, and not all sneezing is from allergies. Sinus infection is defined as an infection that arises in the air-filled spaces in your sinuses. The bacteria irritate the lining of the sinuses and cause facial pain or sinus pressure that is made worse by bending over or by pushing on your face. Your sinuses cannot be seen in routine exams. If Dr. Pasha suspects that you may be having recurrent sinus infections, he may order a CAT scan or CT scan, which is a detailed X-ray of the sinuses. Allergies cause watery eyes, sneezing, nasal congestion, fatigue, and itchiness. Allergies may lead to recurrent sinus infections and nasal blockage. Often allergies are not treated appropriately, or you may be given medication without having true allergies. Allergy management is essential for long-term solutions. Allergies or allergic rhinitis occur when your body's defense system mistakes harmless allergens such as pollen, dust, or grass for harmful antigens such as bacteria. Allergy management begins with allergy testing. If Dr. Pasha suspects you have allergies, he may suggest a quick 10-minute screener called prick testing. This preliminary test may identify some allergens as well as some potential food allergens. However, the gold standard for comprehensive allergy management is skinned endpoint titration, which requires an additional appointment but is much more sensitive in not only identifying what you are allergic to, but also how allergic you are. Another cause of allergic-like symptoms, as well as nasal congestion and a runny nose, is vasomotor rhinitis. Everyone's nose experiences congestion and decongestion throughout the day. This cycle is stimulated by a number of triggers such as a change in weather, exercise, food, postural changes, stress, a hormonal imbalance, smoke, and many others. Vasomotor rhinitis occurs when you have a hypersensitive nose, causing your sinuses to overreact to these everyday triggers, causing congestion, runny nose, or postnasal drip. Finally, there are many structural abnormalities that may lead to nasal problems. Your septum, or the wall that divides the left and right side of your nose, may be crooked. This is called a deviated septum. Your turbinates may be too enlarged from repeated infections and allergies. You may have developed nasal polyps, large balloon-like projections that occur when your nose becomes severely inflamed for a long period of time, often from untreated allergies. These anatomical problems may be seen on a CAT scan or by placing a small scope in the nose in the office with minimal discomfort. Once Dr. Pasha has completed interviewing you, finished his physical exam, and ordered whichever tests may be needed, he will construct a long-term treatment plan specifically for you. He will discuss all options including controlling your own environment, managing your medicines, or may offer an in-office or surgical procedure. We hope that this introduction gives you at least a better understanding of your sinus and allergy complaints. We look forward to discussing this with you and eventually providing you with real solutions so that you may breathe freely both day and night.